Hello, I'm Henry Ingram, and this is my case study on N95 masks. N95 face masks are specially designed respiratory devices meant to fit tightly around the nose and mouth to filter small airborne particles. Demand for them has surged during the COVID-19 pandemic for their use in hospital settings to protect healthcare workers. After they are used, they must be disposed of or decontaminated by specialty equipment. N95 face masks are incredibly valuable to hospitals. They are the only way to prevent healthcare workers who are treating those infected with COVID-19 from contracting the virus themselves due to the mask's filtration technology. If less healthcare workers contract the virus, the more of them are able to continue to work, which is beneficial to hospitals that are being put under a lot of stress by the pandemic. Cloth face masks and surgical face masks are unable to filter particles and only serve as a way of preventing those who are already sick from spreading the virus to others. Only members of the public should be using cloth and surgical masks, while N95 masks should be reserved for the use of healthcare workers. Because of increased demand from hospitals during this pandemic, manufacturers have diverted their resources into producing more N95 masks. For example, the American company 3M tripled its production of N95 masks after a contract was signed between them and the U.S. government. They will not be able to produce as many of their products that are geared towards public consumption because they are using the money they gained from the contract to augment more of their production lines to be geared towards producing N95 masks as opposed to household goods. During the COVID-19 pandemic, the market for N95 masks has not functioned in a perfectly competitive manner. First of all, consumers do not know everything about all the different kinds of N95 masks that are being sold. Certain producers are making N95 masks that operate poorly compared to those produced correctly, and there is no certification that the consumer can look for to make sure they are buying a high-quality mask most of the time. Secondly, businesses are selling N95 masks for prices much higher than those that are necessary to bring them to the market, which is seen by some as price gouging. The government does not want its citizens to be taken advantage of by price gouging, especially during a pandemic. Because of this, the government would implement price controls in the market for N95 masks, making it illegal for them to be sold above a certain price, with hopes of making the product more affordable and accessible to those who are in the market. These price controls do not help these masks get to where they are needed. When the government artificially holds the price of N95 masks down, they financially disincentivize producers from making more of them. When the price is determined by the market, those who need the mask the most will deem it necessary to purchase them at a higher price, when those who do not need them as much will not deem it necessary to purchase them. For example, a hospital in an area that has been harder hit by the virus needs more masks because they need more medical personnel. The higher prices also deter members of the public from buying them, while they are necessary for hospitals to operate. While they are good intentioned, the government should not implement price controls to the market for N95 masks. The market needs to be free to set the price in this kind of situation to generate enough revenue to grow to produce more masks in such a critical time for public health, where demand being met is the difference between life and death.